This is the brachial plexus, so this is the most difficult one of among all the plexuses. Let me start from this area. Okay, so it says ventral rami roots. So remember that the two roots combine together, and that makes the spinal nerve, and then the spinal nerve divides again to the ventral ramus and the dorsal ramus. Ventral ramus and dorsal ramus. The dorsal ramus goes to the back, does not do anything, is not creating any plexus, so we shouldn't bother about it for now. The ventral one is the one that makes the plexus. Okay, so this is why it's a little bit confusing. It says ventral rami roots. So the ventral rami is the one that is coming from the spinal cord, and this area is called just roots. So this is not the same roots that was coming directly from the spinal cord or going directly to the spinal cord, because that is inside the vertebral column. Okay, so the naming is a little bit confusing. So the brachial plexus is made of C5 to T1. Okay, ventral rami, and so C1 and C5 and C6 join together, and that makes the superior trunk. C7 continues as middle trunk. C8 T1 fuses together, and that makes the inferior trunk. Then the trunks will divide into divisions. So there's two divisions. One is anterior division, the other one is the posterior division. So this, and this one. Okay, these three are the anterior division. This one, and this one is the posterior division. Then it divides into cords. Okay, so you have three different cords. You have the lateral cord, you have the medial cord, and you have the posterior cord. So there's three different ones. And then you have the spinal smaller nerves there. So a lot of spinal nerves. These are all spinal nerves, but there are smaller ones. Okay. So this one is called dorsal scapular, and that supplies a rhomboid, minor and major, and levator scapulae muscles. This one is called the subclavius nerve, and that's supplying the subclavius muscle. This is the suprascapular nerve, and that's supplying the supraspinatus and infraspinatus and part of the shoulder joint. This one that you see, this is called the long thoracic. It's not written there. That is for the serratus anterior. Serratus anterior. And this area is for the pectoralis nerve, so for pectoralis major and pectoralis minor. So you can see this area. And also this one is called the subscapular nerve, and that is for subscapularis anteris major. And this one is called the thoracodorsal nerve, and that is for latissimus dorsi muscle. This is the axillary nerve, which is for the deltoid and teres minor. And this one is the musculocutaneous, which I will talk about it in the next slide. And then here you can see that the medial and lateral cords combine and then makes the median nerve. The posterior cord continues as the radial nerve, and the part of the medial cord continues as the ulnar nerve. You also have two other nerves here. This is called medial antebrachial cutaneous nerve, that supplies the medial part of the forearm, and this one that is not written there is called medial brachial cutaneous nerve, which is supplying the medial part of the arm. Okay, and another there's a small mistake here. This is not with I, this is with E, so please fix that. Okay, with E, not with I. And now the rest of the brachial plexus, as you can see, the brachial plexus is supplying the arm, forearm, and the hands. So here let's talk about each one separately. So this is the axillary nerve that I discussed it before. So this is the deltoid muscle, and the teres minor is around here, and also supplies the skin of this area. And this is the radial nerve. So this is from the posterior cord that you can see. It's going like this and goes all the way like this, all the way. So it's a little bit hard to see this because it's the 2D image, so it's a little bit difficult to think about it. But the radial nerve is easy to remember. Is supplying the muscles of the posterior arm, the muscles of the posterior forearm, and also some of the muscles of the back of the hand. Also, it supplies the skin of the arm, the skin of the forearm, and this is all posterior part, okay? And also 3.5 fingers of the posterior part of the hand, 3.5 fingers laterally. So once again, the radial nerve is supplying both skin and motor of posterior part of the upper limb. But when it gets to the hand, it's not supplying everything. It is supplying 3.5 fingers laterally. It goes all like this, all the way, supplying up to here. So the medial part is supplied by the different nerve. There is the musculocutaneous nerve, and this muscle comes here, and that supplies the muscles that cause flexion of the elbow. For example, coracobrachialis and biceps brachii, and also brachialis muscle. So coracobrachialis cause adduction of the shoulder also, and cause flexion of the shoulder. So biceps brachii and brachialis cause flexion of the elbow, and coracobrachialis cause flexion and adduction of the shoulder. So it's affecting both joints, but musculocutaneous is mainly for elbow, flexion of the elbow. Also, it supplies the skin of the lateral part of the forearm. Then is the median nerve that is located more anteriorly, and that supplies the muscles of the forearm, which is affecting the wrist and the hand and the fingers. So that's important for the flexion of the wrist and fingers. Also for the skin, it is supplying 3.5 fingers laterally. This is anteriorly, okay? So radial nerve is supplying 3.5 fingers posteriorly, median nerve 3.5 fingers anteriorly. And both of them are on the lateral side of the hand, okay? Lateral side. The ulnar nerve is supplying a couple of muscles on the forearm area, so that's important for flexion of the wrist and fingers, but also supplying 1.5 fingers medially. 1.5 fingers medially, both anterior and posterior part of the hand.